Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have with us another special guest, and she goes by the name of Vendela Martin. So who is Vendela? Well, she's an influencer, a medical sales rep, and I will tell you no more because you got to listen to the interview. As always, we do our best to bring you guests that are doing things differently in the medical sales space. So I really do hope you enjoy this interview with the content creator and medical sales rep, Vendela Martin. Hi, Vendela. How are you doing today?
Hi, Samuel. I'm doing great. How are you?
I am fantastic. Why don't you tell the audience who you are and what you do?
So my name's Vendela. I'm a medical sales rep. I've been in sales for about 7 years. And I also create content on LinkedIn, which is how we got connected.
She's being so modest, everyone. This is an up-and-coming influencer who's doing big and bad things. One of her most significant reactions to one of her posts was up to almost 2,000 reactions, which is like having 1 million reactions on Instagram. So this is a big deal. But let's start here. What type of medical sales rep are you, Vendela?
So I'm in device sales. So there's different types of sales. I specifically sell a device to GYN surgeons. So I'm in the minimally invasive surgery space.
Okay.
And yeah, that's what I do. I can get into it in a little more detail if you'd like.
Absolutely. A lot of us know exactly what that is, but there are a large number of people listening right now that have no idea what minimally invasive surgery is. Please break it down for us.
So the device that I sell, it allows surgeons to do laparoscopic surgery transvaginally. So there's no abdominal incisions. So that makes it extremely minimally invasive. So minimally invasive surgery, it's essentially using making less incisions into the person's body. And that's really why I'm passionate about the device I sell and what I do, because I know I'm really making a difference.
Amen to that. Now, in this space, do you work with a team? Are you a solo rep? Do you have a clinical specialist, an associate? Talk to us a little bit about what the team dynamic looks like.
So I do work with a team. So I have a team. They have multiple products in their bag. I sell one product. And then I also have a clinical specialist that I work with and a whole clinical education team as well. So I work with probably like seven other people.
Wow.
Yeah, so a pretty big team.
So all to the same area?
Yeah, so I cover Los Angeles up to the coast, so past Santa Barbara. I cover Bakersfield, where I lived for a couple years. And then there are account managers. It's funny, if you're not in medical device, this probably sounds really complicated, but if you are in it, this makes sense. But so there's account managers spread out throughout my territory. So they focus on fewer accounts because they have a bigger bag than I do. And then I sell one device, but I still work with those reps because they might know surgeons that I don't. And they still get compensated on what I sell.
Fantastic. How long have you been in this space?
I've been in this space. So I've been with my current company a year, but I've been in medical device for almost 5 years.
Okay.
And then I started in B2B sales at ADP, where a lot of medical sales people get their start.
Okay, so maybe we should do this a little differently then. Let's go back to college and let's talk about, did you know you want to be a medical sales rep? Answer that.
Okay. Yes, I did.
So it was okay. And then you said, okay, so ADP is going to help me get there. and you did your thing at ADP. Now,
Hmm.
at what point did you say, I've put in enough time at ADP, it's time to go medical sales?
So at almost 2 years.
Okay.
And I was doing really well. Like when I left ADP, I was at 170% to plan. Just had really gotten into my stride. And so it was actually really hard to leave. But I knew, okay, if I don't leave now, I'm probably never going to leave.
Love it. Love
So
it.
I just have to rip the band-aid off and go.
So let's put yourself there. You know, pull us into the experience. You're now
Hmm.
a medical sales rep. Let us know the field you started in, and we want to hear what was the moment in surgery or wherever you had it that you said, "Whoa, I'm doing like this is what I do." Oh my
Yeah.
gosh!
Yeah.
Take us to that moment if you can.
So I definitely felt like that at my second medical sales job. So I really enjoyed my first medical sales job. I started off in dental, but this was during COVID.
Okay.
So I actually didn't have a lot of field time during that role. So I didn't really get the full idea of what it was like to be in medical sales.
Sure.
But my second medical sales job was for this women's health company, and that's a whole other story of how I got to that company. But I just remember I didn't even know that there was a women's health division within medical sales. I think a lot of people think ortho,
Hmm.
they think dental too. At least those were the only two I knew.
Hmm.
So just being in, like, I feel like being in surgery gave me that cool moment where I thought, wow, this is what I get to do. Like I have a communications degree and I'm in surgery. Like that's just kind of mind blowing. And, and like just working with surgeons, working with nurses, surgical techs, like all of these people, they're very educated, talented. And so it's just a very inspiring environment to be in, and it pushes you. Like it definitely pushes you.
But okay, but so then you couldn't say that there was like a specific surgery or case where you said, "Whoa, this is my life," and that's
Uh-huh.
okay, you don't have one.
Yeah. Uh, I would say, okay, so there's not a specific surgery that made me feel like that. I
Sure.
think not that I can remember, but in my current position, I think because the device that I sell, it's new to the market.
Okay.
So I do get more of that, wow, like this is so crazy and exciting in almost every surgery because it's a new approach. And anybody that follows me on LinkedIn, you should know what VNotes is by now because I talk about it enough on there. But so more so at this company I get that, wow, this is incredible.
That's awesome. That is awesome. Okay.
Not discounting what I sold previously. It's just different when it's something brand new. You're with a surgeon and hey, they're like the first person at this hospital ever using the
Right.
device.
Right. No, it's a big deal. It's a very big deal.
Mhm.
Okay, so then talk to us about when did you start creating content? So you knew you wanted to be a medical sales rep. By the way,
Mhm.
in college, when did you find out about medical sales?
I found out about it in probably my junior year in college. So I originally wanted to be a psychologist. And but then I heard about medical sales. Like someone told me, "Hey, I think you'd be really good at medical sales." I thought I was going to go into the aesthetic side. But so that's how I heard about it. Just a recommendation from someone.
Wow. Okay. So you hear about it. You say this is what I want to do.
Hmm.
You start doing it. You're loving it.
Hmm.
When you say, you know what? I'm going to get on LinkedIn. I'm going to make a post about this.
It was actually almost exactly a year ago. I started creating content. And it was 100% because of Omar Khatib. Anybody listening likely knows who he is. And if you don't, you should definitely follow him. But so he had a program about creating content on LinkedIn and just was very passionate about LinkedIn and medical sales. And that's not something I had ever heard anyone talk about. And I'm very open minded. So I just thought I believe in branding. I believe in social media. I don't have Instagram or anything else, but I just really agreed with what he was saying and decided, all right, I'm going to try this. Worst case scenario, I don't know. There is no worst case scenario. Like,
Yeah.
the worst thing is,
Nothing
hey,
to lose.
nothing comes from it.
Yeah, nothing to lose.
Exactly. So I had nothing to lose. And it's funny, when I first started creating content, I don't know if anyone else has done this, but when I first started creating content, nobody likes your stuff in the beginning. So I would text it to my fiance, my dad, and one of my best friends, like, please like this. And so it's funny, that's how it was in the beginning. And now I don't have to do that, thank goodness.
Right.
That would probably be pretty obnoxious at this point. But the why was mainly, first, it was to create a brand for myself and to be able to connect with surgeons in a new way. But it's definitely become much more than that now.
That is beautiful. So share with us, what are the opportunities that you can create for yourself by being someone like that chooses to be a content creator like you? What share with the audience what sort of things have happened that most likely wouldn't have happened if you hadn't decided to go this route.
So many things. So one of the biggest things is like being able to network so easily. So I get messages from people all the time just wanting to talk, ask for advice, how to break in, or just network. And I can't respond to everybody, but that's a quality problem to have. Whereas before, nobody was reaching out. But I mean, some people here and there, but nobody was reaching out consistently. But a big thing has been other companies reaching out about roles. So like recently, I won't say the company, but this manager had reached out. We're going to be opening up a new division. I don't want to say too much, but there's going to be this new division. I really want you to come over to our team. Like, I love your content. I love your philosophy around sales. So it's like, he didn't ask me anything. He just knew from seeing my content, seeing my experience, and understanding my mindset. Hey, I want this girl on my team.
I love it.
And it's a big company. So not saying I'm going to go over. I hope my company doesn't get nervous if anybody listens. But so I've had a lot of those types of opportunities come up. And just like being able to connect with, like, I've talked to VPs, CEOs that I really wouldn't have probably been able to connect with before. So, and then also the community aspect. There's so many great people that are creating content on LinkedIn. And so I've been able to just learn from what other people create as well.
That is so exciting. So you're a content creator, you're meeting new people, you love what you're doing.
Mm-hmm.
Why should, if you were to talk to someone that is not really good on this kind of thing or doesn't like being in front of people or whatever their reasons are, what would you say to them? Would you encourage them to do what you did? Would you say, you know what, if you're not that kind of person, then don't worry about it? Or talk to us a little bit about, I guess, the value for anyone to consider going this
Yeah. Well, if somebody had a desire, so I've had so many people tell me, oh, I'm too old to be creating content like you, or that's just not my personality.
route.
But I just think, like, get over it, and I mean that like in a very friendly way, but just get over it, do it. Like, there's so many things in medical sales that, hey, are kind of out of your comfort zone, but you just have to go do it. And the more you do it, the more comfortable you get.
Absolutely.
So I think you have to have a desire to want to create content. I don't think you can force it, because I also think people can tell if you're being genuine through your content.
Sure.
At least that's just my opinion. Like, even commenting on people's posts, like, that's a huge part of LinkedIn.
Yep.
It's almost like it's as important or almost more important than creating content.
Yeah.
And I think, yeah, if you're not being genuine with your comments, Like it just seems like something AI generated. I have nothing against AI, but yeah, you have to want it. So I think I'd only tell somebody to get over that fear if they really wanted to do it.
Gotcha. I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. Gotcha. This is fantastic. So Vendela, you have a lot of people listening right now that want to be where you want to be. They're excited by the fact that you're sharing your stories on how to be where you are. Talk a little bit about, I'm sure you had the idea of what it means to be a medical sales rep before you became one. And now you are one with significant years of experience and you know what it is. What are the differences or were there no differences for you?
Like what are the differences between
What
I thought it
versus what it actually is?
So I definitely thought it was going to be more glamorous than it actually is. So I think like you see movies, and I think pharmaceuticals is maybe a little more glamorous because you can dress up a little bit different. So, and I thought, I don't know, it's funny. I think everybody has an idea of their mind about what sales is. Like before telling my dad exactly what I do, he just thought like, oh, I just am constantly just like easily talking to doctors, telling them, hey, this is what this is. And then they go do it. And there is so much more to that, like so much more to the job. So right. I think, I probably went into the industry thinking it was more simple than it was. And it's a very complex industry. And that was probably the biggest thing. But I love it, but it's definitely not for the faint of heart.
Well said. A few last questions. So we want to give us a day in the life of Vendela, the content creator / medical sales rep, or I should say the medical sales repping content creator. There we go.
I like it.
Give us the, you wake up at what time, you're doing what, how do you make it all happen?
So I feel like everybody says the same thing, but every single day is different. So I could wake up very early because I have a surgery in the morning. So, I might be waking up at 4 or 5 in the morning, getting ready to drive to a hospital. And then for those that aren't in the industry, you get to a hospital early to make sure that the OR has everything that they need. Just making sure everything is prepped for the surgery because that's huge. And surgeons appreciate that. So I just listened to your recent podcast where the neurosurgeon, he brought that up, how, and it really is important. So hearing him bring that up, it just reconfirmed to me how important that is. But so covering surgeries, trying to schedule meetings. So that could be like in person, going to a doctor's office, making phone calls. I also do outreach on LinkedIn. My days, sometimes I'm doing in-services because a lot of the hospitals that are using my device, it's new. So there's a lot of training involved. And yeah, I'm just trying to grow my territory. But so there's so many different aspects, but every day is different and you decide what it looks like. And I just try to plan my days around, okay, what opportunities do I have going on? And like what's going to actually generate business or revenue, maybe not today, but 3 months from now, because that's another thing. That's another thing I didn't realize about medical sales was it's a lot of the times it's not instant gratification. So when I was in B2B, you can meet with someone, close a sale same day, and you get that revenue right away. But in medical sales, it's definitely what you do this week, you might not see for a month, 2 months, 3 months, or even a year.
Those are the facts. You could not have said it any better
Yes,
than that.
facts.
And then when do you find the time to create content in this busy, productive medical sales rep of
Mhm.
yours?
So great question. So I actually schedule my content, and I really only post once or twice a week. My manager said it seems like I post every single day. I don't know if that's an insult or a compliment, but but so I try to schedule everything. But I'm not one of those people that on the like, oh, on Sunday, I plan out all my posts. A lot of my content, it's just from what I'm experiencing that week. So it's almost like my diary. It's like, hey, if I'm thinking something or I just realized something, that's what I share. So, but yeah, I try to schedule it, and I try to post around the same time.
That's fantastic.
Yeah.
Vendela, it was awesome spending this time with you today. And we
Mhm.
have one more thing to do. It's called the
Oh
lightning round.
no. Ooh,
Are you
okay.
ready?
I don't know. I'm ready. I'm ready.
All right, I'm going to ask you four questions. You have less than 10 seconds to answer. First
Okay.
question, what is the best book you've read in the last 6 months?
Oh gosh. The Confident Mind.
Ooh, that just sounds good. Who wrote that?
This guy Nate Zinsser.
Was it good?
Very good. So he does training for, like, he trains athletes, Navy SEALs, just all about mindset. But
Good.
so his, yeah, and confidence is so important in sales,
Yep.
and I think just in general. So I love those types of books, and yeah, it was a really great book.
That's fantastic. Okay. Next question. What is the best movie or TV show you've seen in the last 6 months?
Uh, oh, okay. I just saw this movie Cabrini. Have you heard of it?
Never even heard of it. What is that?
Okay, so not a lot of people have heard of it. So it's based off a true story. This woman, and it's a newer movie. But so she's a nun. I think she's a nun, and she just has the biggest heart, like very selfless person. She wants to open up orphanages all across I think just all over the world. But I don't know if that was her original goal. Her original goal was she just wanted to create more orphanages to for kids to go so they had a home. And oh, just I like, it's such a powerful movie. It actually makes me emotional thinking about it. So
Okay,
it's
everyone.
inspiring, very inspiring.
Cabrini will be in the show notes, and so will the Confident Mind. That will also be in the show notes.
Mhm.
Okay, that's fantastic. Now, when it comes to third question, what is the best meal you've had? We want the item, the restaurant,
Mhm.
and the location.
Oh gosh. Best meal I've ever had?
No, in the past six
Oh,
months.
the last 6 months. Okay, so there's a restaurant, maybe you've heard of it because you're in Los Angeles too, Hatchet Hall, or it's either the Hatchet or Hatchet Hall.
Where is this?
It's in Los Angeles. It's a Michelin star restaurant.
What? Oh, I'm going there now. No, I
You
haven't
need
heard it.
to.
Hatchet Hall. What's there? What type of food?
So they don't have a specific type of food. They have a little bit of everything, but they had this steak that was just incredible. I love steak. And let's see but we had so many things. We went with a couple friends. The food, you're supposed to share it with people.
Okay.
So you have a little bit of everything, but incredible,
The
incredible,
Hatchet Hall.
incredible steak.
Okay. Okay. That will also be in the show notes, folks, and I will be going there, and I will be
Yes,
giving
you
my
should.
review on a future episode. Maybe another one with Vendela. And then, last question, but not least, what is the best experience you've had in the last 6 months?
Ooh, good question. Let's see. Gosh. Okay, I'm going to take more than 10 seconds, I think. Um, I think the best experience I've had in the last 6 months. Well, so right now, the first thing that comes to mind right now, I'm in Florida because my fiance, he won a trip through work. So
Okay.
he's in like the top 0.001% of salespeople at his company. Like
Fantastic.
that also helps me become a better salesperson because I live with.
Right? A little friendly competition going on. I see it.
Yes. Yeah. So I'm very lucky. But so being here, like we're at this crazy nice hotel in Florida, in Boca Raton. And so just being like, I love being around people that, just think big and are good at what they do. So for me, it's just very inspiring. So this has been a great experience for me and being able to tan and relax.
That is beautiful. Well,
Yeah.
Vendela, again, thank you for joining us to talk about your experiences and your content creation and all the wonderful things you're doing. We can't wait to see what's coming from you. And thank you again for being on the Medical Sales Podcast.
Yeah. Thank you so much for having me. This was really fun.
Absolutely. And that was Vendela Martin. Fantastic stuff, right? Of course, I am at the forefront of what a brand on a social media platform can do for you. And let's be honest, it's the name of the game in this era. But it's a beautiful thing to see someone that is in the industry take the time to share their thoughts and experiences with the world and what it can truly do for them. One thing she highlighted is being an influencer, and I'm going to say that in quotations, but being an influencer, being someone that regularly shares your experiences with an audience in the medical sales space, it's a powerful thing. And it's a powerful thing for your own career because of the career trajectory it can put you on. You're literally giving the entire world how you see life, the philosophies that drive you, how you manage the failures you experience, and how you use whatever experience you have to achieve success over and over and over again, and all the people you meet in between, while commenting, reacting, and networking with other people that are doing the same. It's inevitably going to position you so that anyone that's interested in a position that's above your current station already has insight into how you might show up if given the opportunity. It's almost like a magical thing. And we can't stress it enough for people to take this seriously and get comfortable offering any kind of content that's positive and shows what they're experiencing to the world in the realm of LinkedIn, especially if they're in medical sales. So if that's you and you're thinking, you know what, I love what she's doing, but I just don't know what to do. I don't know what steps to take. Then again, I'm going to tell you to do something. And you know what I'm going to say. Visit evolveyoursuccess.com, fill out our application. In the How Did You Hear About Us section, put referral and put down that you're interested in learning how to be an influencer. And someone of us will reach out to you and have a discussion about how you can be someone that's learning how to promote yourself to create opportunities for your career trajectory while informing and educating all of your colleagues about things that they can learn from that you also have learned. As always, we do our best to bring you guests that are doing things differently in the medical sales space. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional, or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.